This is the Babypac ventilator. We use this for babies from birth to 10 kilograms. One of its benefits is that you can ventilate the baby purely on oxygen, or we can use air as well. It can be very useful for some of our newly diagnosed cardiac babies. We're going to set up the Babypac ventilator. This is how we find it, having come back from a previous trip. So first of all, we check the external aspect of the box to check there's no damage and that it hasn't been dropped. We can see that the diaphragm and the hub hasn't been attached, so we take one and prepare to install it. Check that the hub has no holes and slip it gently over the top, making sure the diaphragm isn't kinked. Then tightening the hub over the top, again making sure the diaphragm isn't caught in the threads. Next, we're going to attach the ventilator tubing. We check we've got the correct tubing for this ventilator. For setting up the basic Babypac, it doesn't matter which section is applied to the inspiration or the expiration port. We check that the holes at the end are closed and have a rough look at the tubing to check there's no obvious hole or damage. Next, we're going to plug in the gas supply. Put the oxygen in. The eyeball should go white. Similarly, when we put the air in, the eyeball should go black and white. We can see that the gases are attached properly because the eyeballs have changed completely. Then we check the ventilator for functionality. This dial here is giving us the percentage of oxygen. Because we've got oxygen and air attached, we follow the yellow line, which goes from 21% oxygen round to 70%. If we just have oxygen attached, you follow the white line, which is 50% round to 100%. Pressures are set using these two dials. The PEEP valve is dialed up, and then the peak pressure is dialed up according to the child's chest movement. Respiration is set with inspiration and expiration. The inspiration is set between 0.75 and 1, and then the expiration accordingly to the rate that you would like the child to be ventilated on. Then I'll be using a false lung to test the ventilator. 0 is off. CMV with PEEP will give you PEEP, but it's not continuous. We tend to favour CMV with active PEEP. We're going to turn the ventilator onto CMV and active PEEP. At the moment, we're delivering 21% oxygen. We have a PEEP reading of about 4 and a peak pressure of about 24. With CMV and active PEEP, PEEP is maintained between breaths. When we change it to CMV with PEEP, in between breaths the ventilator isn't delivering a constant PEEP. CMV and active PEEP is the mode that we prefer. For calculating the rate, we've set the inspiration to roughly 1. The expiration is set to 2. 1 and 2 is 3. 60 divided by 3 gives us 20 breaths a minute. That can be adjusted according to the needs of the patient. Troubleshooting the ventilator is very straightforward. There's very little that we can start adjusting. It's always important to make sure these two plugs are in the hole. That's a common error when the ventilator isn't working properly. Other errors include holes in the tubing that haven't previously been detected, and you can spot those by running your hands along and checking if there's any air escaping. Another common error could be that despite the best of intentions, the diaphragm is not lying neatly over the hub. That's a good place to check. Another area could be that the oxygen or air leads have become loose and you can feel that there's a lot of air escaping from that location. The Babypac comes with alarm limits to prevent the child from having too high ventilation and damaging their lungs. The alarms are set, the peak alarms are set using this dial, and it also limits the amount of pressure that you can ventilate with. So this, if we turn this alarm right down, it will alarm and tell us when the ventilations go above 18. We're happy for this child to have higher than that ventilation, so we turn it up and it allows the higher ventilation to occur and doesn't start alarming at us. Once the ventilator is no longer required, you can turn it to the off position and disconnect the oxygen and air supply. The disposable parts of the circuit can be put safely in the clinical waste dustbin, but the hub and the diaphragm are non-disposable parts. So the diaphragm and hub are put in the box in the sluice for the PICU technicians to clean and put in the sterilizer ready for reuse. Once you've removed all the removable parts, it's then time to clean the ventilator. For infections including Clostridium difficile and norovirus, we would use sporicidal wipes, cleaning the box and all the tubing. For all other uses, we would use just our universal wipes to wipe it down and allow it to dry naturally in the air. Babypac up, ready to deliver CPAP to a patient. CPAP is good for children 5 kilograms and under. It's a slightly different tubing from when we're using the Babypac ventilator as a ventilator on its own, and it has a single prong and much thinner tubing at the end. Again, it makes no difference which port the tubing is put into. Once we get to this bit, we disconnect the central hub. And we can keep that in case we need to convert the ventilator later. Having prepared this side, we're then going to get the patient ready. First of all, it's important to make sure the patient has the right size hat on. And so we take the tape measure from the kit and we measure their head. And this patient needs a black hat. Okay. You choose that from the colours at the edge of the hat. And we know from our measurements the black hat is the right size for this patient. And this goes on colour down. We've then measured and make sure the right size nasal prongs for the patient are utilised. And we can test this by holding it against their nose. We then use the connecting device and connect up the ventilator. Again, it doesn't matter which size we use. And we can insert the nasal prongs into the connector. Often you need help, but the prongs can be gently inserted into the baby's nose, and we would gently turn the ventilator on, starting at a low pressure. As the baby tolerates it, that can be increased until you reach the optimum level for that baby. Once the baby's happy with the CPAP, using the connecting strips, getting a colleague to hold it in place, we anchor one end to the baby and one end to the hat. And similarly on the other side. Thank you. We can then anchor the top to give a little bit of pressure off the nose and hold everything in place. Lovely. To set the CPAP, turn the dial to CPAP and then adjust the pressure as you would like according to the child's needs. So this child now is receiving PEEP of about 5 and seems to be very settled on that. Everything you need to set up CPAP on the Babypac ventilator is in the cupboard in the retrieval room, and there are also packs stored in the ambulance should you need one when you're out, and they contain all the tubing and all the extra bits you need to safely assemble and deliver CPAP.